Hello and welcome back to SHG Diabetes Education Podcast. I'm Bronwyn Newman, a credentialed diabetes educator and the director of SHG. My passion is empowering individuals and families living with diabetes through education, support and evidence-based care. Through this podcast, I aim to help people better understand diabetes, build confidence in self-management and improve health outcomes at every stage of life. Today's episode focuses on an incredibly important topic, which is diabetes in pregnancy. We'll explore the impact of elevated blood glucose levels on maternal health and newborn health, discuss the difference between type 1, type 2, and gestational diabetes, and talk about practical strategies that can improve outcomes for both mum and baby. Whether you're planning a pregnancy, currently pregnant, supporting a loved one, or simply wanting to learn more, this episode's for you. Understanding diabetes during pregnancy. Pregnancy places unique demands on the body. Hormonal changes naturally increase insulin resistance, making blood glucose management more challenging for some women. There are three main types of diabetes that may be present during pregnancy, which is type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is an autoimmune condition where the body immune system attacks the insulin-producing cells in the pancreas. Women in type 1 diabetes require insulin therapy throughout pregnancy and often need close monitoring as insulin requirements can change significantly during each trimester. Type 2 diabetes occurs when the body becomes resistant to insulin and is unable to use it effectively. Women may enter pregnancy already living with type 2 diabetes or may be diagnosed prior to conception. Glycemic management before and during pregnancy is essential to reduce complications. Then we're up to gestational diabetes. So gestational diabetes develops during pregnancy, usually between 24 and 28 weeks of gestation, although it can be earlier. It happens when pregnancy hormones interfere with insulin's ability to regulate blood glucose levels. The placenta plays a crucial role in gestational diabetes as the placenta secretes hormones that increase insulin resistance, which leads to the elevated blood glucose levels during pregnancy. For many women, blood glucose levels return to normal after birth. However, gestational diabetes significantly increases the risk of developing type 2 diabetes late in life. Why glycemic management matters. When blood glucose levels remain elevated during pregnancy, excess glucose crosses the placenta to the baby. The baby responds by producing additional insulin, which can affect growth and development. While pregnancy can be a very exciting time, it can also be stressful, especially when your blood glucose levels are difficult to manage. The good news is that proactive management can significantly improve outcomes for both mum and baby. So the impact on maternal health. Let's first discuss the impact on mums. Unmanaged elevated blood glucose levels during pregnancy can contribute to several health concerns, including the risk of high blood pressure, the increased risk of preeclampsia, higher rates of cesarean delivery, increased risks of pregnancy complications, greater likelihood of developing gestational diabetes in future pregnancies, increased risks of developing type 2 diabetes later in life following gestational diabetes. Beyond the physical impacts, many women experience anxiety around blood glucose results, stress related to pregnancy outcomes, feelings of guilt or shame or blame, emotional exhaustion from constant monitoring and decision making. It's important to remember that diabetes management during pregnancy is not about perfection. It's about making informed choices, working closely with your healthcare team, and aiming for consistent progress. So we'll go over next the impact on baby's health. Now let's talk about how elevated blood glucose levels can affect your babies. So we've got the large birth weight, which is the macrosomia. When excess glucose crosses the placenta, babies may grow larger than expected. A larger birth weight can increase the likelihood of birth complications, assisted delivery, cesarean section, shoulder dystocia during delivery, birth injuries, and neonatal hypoglycemia. After birth, babies who have been exposed to higher glucose levels during pregnancy may continue producing increased amounts of insulin, and this can cause low blood glucose levels shortly after birth and may require monitoring and treatment. It also discusses neonatal jaundice. So babies born to mothers with elevated blood glucose levels may have an increased risk of jaundice, which causes yellowish skin and eyes and may require some treatment. The baby's also at risk of respiratory distress syndrome. Some babies may experience breathing difficulties after birth, requiring specialised neonatal care and observations, and long-term health risks. So research suggests that exposure to elevated blood glucose levels during pregnancy may increase a child's risk of obesity, insulin resistance, type 2 diabetes, metabolic health concerns later in life. Now, this isn't meant to scare or make you feel guilty. It's knowledge, it's to empower, it's to aim to take insight into glycemic management into account when we're pregnant. So this is why achieving target glycemic levels during pregnancy can be a benefit that extends well beyond birth. Improving outcomes through glycemic management. The encouraging news is that there are many effective strategies available to support healthy pregnancies. Healthy eating and balanced nutrition. We all know that nutrition plays a key role in glycemic management. Nutrition plays a huge role in our health overall. So, first of all, I would say I'm a registered nurse, credentialed diabetes educator. I would always suggest that you go and seek a dietitian. But for a little bit of a discussion about nutrition, you can focus on the low GI components and research a little bit into what's healthy during pregnancy, because we still need carbs for development, for the fetal development. So it's bigger than just whole grains and lean proteins. Look at healthy fats, plenty of vegetables, appropriate food choices, regular meal patterns. Always go and see others to assist you with your healthcare goals. We've got a collaborative team care pathway, so see your obstetrician, see your GP, see your allied health. And I'm sure that they would instill the same type of guide here, that you should be limiting the highly processed foods and sugary snacks. You'll reduce your blood glucose spikes. The Baker's Heart and Diabetes Institute offers excellent evidence-based resources for women managing gestational diabetes during pregnancy. You can work with an accredited practicing dietitian and they will help create individualised nutrition plans that support both mum and fetal growth. So then it takes us on to the next part, which is regular physical activity. Physical activity helps improve insulin sensitivity and supports blood glucose management. Examples include walking, swimming, prenatal yoga, pregnancy-safe strengthening exercises. Aim for approximately 30 minutes of moderate activities on most days, following guidance from a healthcare team. You can seek help from a women's physio exercise physiologist. Even a short walk after meals can help improve post-meal blood glucose levels. And this is where it brings me to monitoring blood glucose levels. Regular blood glucose monitoring provides valuable information about how your body responds to food, activity, stress, illness, and medications. Remember, blood glucose numbers are information, not judgment. It's not about guilt. They help guide your care and support better outcomes. Another thing that helps with better outcomes, sometimes you might require medications. So medication management, sometimes nutrition and exercise alone are not enough to achieve target blood glucose levels. This is not failure. Pregnancy hormones can create significant insulin resistance, making management challenging despite best efforts. Some women may require insulin therapy. Other pregnancy-safe medications, as recommended by your healthcare team, they may also be required. If medication is recommended, it is because the benefits of achieving target glucose levels outweighs the risk of ongoing hyperglycemia. So that's high blood glucose levels. Building your pregnancy diabetes care team, one of the most important factors in successful diabetes management during pregnancy is having the right support network. A collaborative healthcare team may include credentialed diabetes educator. A credentialed diabetes educator can assist with blood glucose monitoring education, continuous glucose monitoring support, insulin education, problem-solving strategies, emotional support and confidence building. And if we go into accredited practicing dietitians, a dietitian can provide individualized meal plans, carbohydrate education, nutritional guidance, practical strategies for managing blood glucose levels, and as we spoke about earlier, women's health physio. A women's health physiotherapist can assist with pregnancy-safe exercise programs. They can assist with pelvic floor health, back and pelvic pain management, physical preparation for birth and recovery. Which brings me on to another important allied health provider, which is podiatry. A podiatrist can support with foot health assessments, circulation monitoring, prevention of diabetes-related foot complications. And also one of the most important is your primary general practitioner and private obstetrician. So your primary GP plays an important role in coordinating your care, monitoring health, and supporting both pregnancy and postpartum follow-up. Your obstetrician provides specialist pregnancy care and helps manage any pregnancy-related complications while supporting the safest outcome for both mum and baby. Together, your collaborative pregnancy team creates a care pathway that focuses on achieving the best possible outcomes. Now, this podcast is probably just a short, brief start to diabetes and pregnancy. But in closing thoughts, managing diabetes during pregnancy can feel overwhelming at times, but you do not have to navigate the journey alone. Small, consistent actions can have a profound impact on both maternal and newborn health. By focusing on health nutrition, regular physical activity, blood glucose monitoring, and medication where required, we can engage with a supportive healthcare team. Women can significantly improve outcomes for themselves and their babies. Remember, pregnancy is not about achieving perfect blood glucose levels every day. It's about working towards your target, learning from your results, and accessing support when needed. One last thing before I close, I'd like to also discuss that in pregnancy, gestational diabetes type 2, type 1, continuous glucose monitors, or the CGM, is an absolute resource for glycemic management. So you can always see your credentialed diabetes educator, endocrinologist, and seek out trialing a CGM. So thank you for joining me for episode 2 of SHG Diabetes Education Podcasts. If you found today's episode helpful, please subscribe, share with others, and join me next time as we continue exploring practical strategies for living well with diabetes. Until next time, take care of yourself and remember that education is empowerment, not guilt. Take care.